That's all right.
Thank you so much for making yourself available. Do appreciate it.
My pleasure.
Okay. So accreditation, what is it? Why does it matter?
So accreditation is a series of tests to demonstrate that a laboratory is able to perform to a certain level. So we use ISO accreditation in medical laboratories to provide assurance to users, so that could be clinicians or the public, that the results that are being generated are of good quality. And it's a global standard, so it's something that's a global gold standard held by many laboratories in high-income countries. And what we're trying to do through our project funded by the Wellcome Trust and working with PHA4GE and other colleagues is to improve accreditation in low-income and middle-income countries to improve global health equity.
What kind of challenges do those pose?
So there's lots of challenges in middle-income countries, particularly when we're thinking about technologies like genomics and bioinformatics. So genomics and bioinformatics have a heavy digital element, and taking a laboratory where people are used to working in the wet lab, carrying out experiments on a bench, and moving into a space where the experiments are carried out on computer is quite challenging. Even in high income countries it costs a lot of money, you've got a heavy staff training burden, and that creates a whole host of challenges. And the way that a lot of high-income countries have dealt with it is by throwing money at the problem. Clearly you can't do that in a low middle-income country setting. And so what we've been doing as part of the work that we're trying to undertake is to take some of the lessons that we've learnt in Public Health Wales and to work with colleagues at SAMBI and in other locations across Africa to design and develop a set of modular components that lower the barrier of entry for labs in low and middle income countries and allow them to start their own journey towards accreditation. And that's got all sorts of potential in terms of improving public health and global health, and that's really sort of at the heart of what we're trying to achieve.
Is it a hard sell? Because obviously you have to, what's the pitch, what's the elevator pitch that you make to say this is why you should spend the few resources that you have?
So for a lot of countries, there are tests increasingly that they're going to need to provide. So in Wales, we use genomics to characterise HIV resistance, and we use it for TB and characterising TB resistance. And really, those are the gold standards. And so the pitch is very simple to anyone, which is that do you want to provide the best possible test for your population? And when we look at diagnostics around things like tuberculosis, for example, genomics is often competitive in terms of price with other approaches that are less good. And so, enabling people to be able to make use of those in low and middle income countries is really, really important for ensuring better health amongst those populations.
So ISO 15189, that is the standard that you're aiming for?
Yeah, so ISO 15189 is the medical laboratory standard. It's a globally accepted standard. It's required in many high-income countries by law in medical laboratories. It also is often required for clinical trials. So if you're in a low and middle-income country setting and you want to attract clinical trials, if you've not got the accredited labs, pharmaceutical companies are not going to choose you. So it's a real gateway for not just improving health in your population, but also attracting income, which is also really, really important.
Just out of interest, South Africa, how well are we doing along the standards? Are there any African countries who are able to meet?
There are quite a few African laboratories that have ISO 15189 accreditation for wet lab processes, but far fewer that have them for the genomics. And so where we're starting to say, well, if you've got the wet lab accreditation for a wet lab diagnostic, here's how you can build towards getting it for genomics. And so we're just aiming to lower that barrier of entry, make it a bit easier for labs to achieve that accreditation and gain the benefits from genomics in their delivery of healthcare.
And the workshop the past few days, have you been, I assume these are the kinds of things you've been discussing?
Yeah, so we've just been running a workshop today, and that workshop has explored some of the issues around accreditation and shared some education, some learnings with the people in the room about how they can potentially improve their ability to get accredited. So we've covered things like the challenges of introducing bioinformatics as a skill and the issues around differences in language and understanding between bioinformatics and wet labs. We've covered designing validation and verification data sets. So those are the data sets you need to demonstrate that a test works and that a test continues to work. And then we finished up with a session around competencies. So how do we make sure that our staff have the right training to do the work? And also, how do we create a career model that allows us to develop our staff as they go on? Real problem in a lot of African countries is you invest a lot of time and effort developing individuals who've got skills in genomics and bioinformatics, and then some agency from a high-income country comes in and recruits them and takes them away, and you lose that skill set. And so if you focus on how you build competencies and how you have the right training in place, you can make yourself resilient against that, and you can train many people with those skills, and you can maintain those services into the future.
I assume among the people that you have in these rooms, there is quite a lot of enthusiasm for these kind of frameworks and accreditation. Do you still have to sell it upwards as well?
So I think there's always a challenge with selling it upwards, and we live in a world where we're financially constrained no matter where we are. But I think the thing for ISO accreditation is it's increasingly an expectation that we will have this standard.
Yeah, there's always a challenge.
There's always a challenge in trying to justify why you should spend money on something which is potentially expensive. I think the thing with ISO accreditation is increasingly our public is going to expect that we have these services, and people are going to increasingly expect that they're going to get, the advantages of having something like genomics, where they're going to get the right treatment for the disease that they've got. And if the only way to achieve that is to do it via ISO accreditation, then we're just going to have to pay the price. I think what I'm interested in doing, and I think one of the key things about the work is that rather than having everyone reinvent the wheel themselves, why don't we share the expertise that we've got? Why don't we provide a mechanism to share best practice, so that rather than having to build from nothing and spend all that money trying to build something out of thin air, we can actually take things that other people have learned, take the insight from elsewhere, and then use that to do things much more quickly and much more cheaply. So we're trying to lower that barrier of entry, lower that cost, and bring those benefits to the population around the world.
And that is my quotable quote. Thank you so much.
Go.
That's absolutely brilliant.